a reduction on birth rates, perhaps, or not a reduction, but a plateau. But what I think is happening is all these companies that want to create like a humanoid robot. Well, once they've got enough robots to replace the human workforce, I reckon they'll probably get rid of us, or won't need us anymore. So a lot of us will die of disease or illnesses that we can't afford to cure. You know, this is another thing that's happening in America, where people can't get the help they need because it's too expensive. They can't get health insurance.
And here we are, so lucky, and we're going down to the
and the NHS has been crippled by people abusing it.
For a prescription for a paracetamol, yeah, for £8, 80 pence, yeah, where you can go down to Tesco for 24 pence.
I know.
Our NHS is going to die if you carry on, little bits and pieces like that.
Who is going down to the flipping hospital to get bloody paracetamol? You know what I mean? I mean, they still haven't done a campaign about that, have they? They haven't done a campaign like said it. They've had it on the news, but they haven't done a campaign saying, please don't get your paracetamol from the hospital or your doctor or your pharmacy. Please go and get it in your local supermarkets. No one's doing it because surely nobody would deliberately go, I need to get paracetamol from the hospital. Who does that? Who needs to do that? I mean, the only place where that should be available to buy is in when you're actually in hospital and you can't go to the shop.
I think there is one with the perspective point of view, and that is you take a whole day off work to run down to the doctor to ask for a paracetamol. Yeah,
but that's people skiving. Not actually, you know,
So what they have is a holiday.
If we're not talking about that, people. Oh, we are talking about that. People abusing the system. This is
a lot
America,
of people
American
are abusing
focus.
the system. You want the NHS, yeah?
In America, they've got to pay for
it.
it. Huh?
Yeah, if you want the NHS, you've got to stop little things like that. Yeah.
Yeah, but these little things are there on purpose to make the. Okay. Let me make something very clear. In my opinion, it's only my opinion. I think that all these organisations, from the police to the NHS, all these government organisations, are deliberately corrupted on purpose. Okay? Yeah. And they do it on purpose to get what they want. Yeah? So, there'll be certain agendas that certain people who want the NHS to be crippled. Yeah? Want people to get angry. Because what does it create? When people say they can't have their vital operation,
yep.
They've been a taxpayer all their life, and they need a vital operation, but their local hospital says that they can't do it because they can't afford it, and then because they're wasting money, hemorrhaging money on giving people £8 for flipping paracetamol that costs 20p or 25p. Yeah.
Yep.
So what happens is, who gets angry? They get angry. And they might appear on TV or make a blog online that gets tens of thousands of views. What a disgrace, I can't get my life-saving thing. Maybe someone's got cancer and they need life-saving chemo, but they can't get it. They've got to drive 20, 30, 40 miles, pay for their own transport to get to where they need to get the chemo or cancer treatment. That's a true thing. Somebody at my company where I work, she was going around like begging for money because she couldn't afford the transport for a friend who got cancer. But luckily, I told her and informed her of a charity called Macmillan, who will pay their transport. You know. I mean, I don't like chemo. I don't agree with it. Yeah. I reckon deacidification of the body is one of the main things that beats cancer. Yeah. But a lot of people who get cancer, they eat a lot of processed sugar. They're very, very acidic bodily wise, which creates the environment for cancer to grow. Not that it causes cancer, but your body needs to be like alkaline and able to be in its full best. So if your body is balanced,
Mhm.
And it'll be easier to fight off cancer and other diseases than it would if you was full of, for example, if I've got a cold, the last thing I should be eating is a bag full of sweets and some donuts. It's the worst thing. What I want to be eating if I've got a cold is avocados, fresh fruit and veg, things full of minerals and vitamins, and alkaline. But anyway, let's go off on a little side note. People can't get what they need, okay, because the NHS turns around and says, we can't afford your treatment because we don't have enough money. And we know because it's been hemorrhaged by people who are abusing it. Yeah? But in America, it's a little bit different. In America, they have to have health insurance. And they have to pay for it all themselves.
And that's what I believe we should
And they
have.
can't get treatment either, some of these people. They've got to go across 3 states just to get what they need.
I believe
disgusting.
that we should have the same thing. As America, universal card for medical, blah blah blah. And that will stop the abuse, of irrelevant and stupidity.
What will stop the abuse?
Paracetamol that costs £8, £50, right? When you can go down to the local supermarket for 24 pence, right? They're coming out of your money.
Yeah, but all it have to do is the government to overrule the prescription of paracetamol and ibuprofen and things like that from hospitals or your doctor.
Yeah, but
That's simple.
What I'm saying is this: we should be in an American system, right? The Americans have to pay for their own medicine. If we do the same as America, I guarantee you, people won't go running around for paracetamols.
What they need to do is just stop it.
No, well, this is the only way.
I
to
should
stop
be.
it.
I should be.
This
We
is the
listen.
only way to stop it.
We pay for the NHS
Yeah.
through our taxes.
No, but
Yeah,
no,
I
forget
paid
that.
for it.
Forget that. Right? Put it back into common sense. Yeah. Back in 1700. Do you think there'll be a medicine with it free? Blah blah blah. Of course not.
It's not free.
Huh?
We're paying for it with our tax. It's only free for those benefits
In the
sponge of bums.
1700,
What?
In the 1700.
You just said
No,
about it being free. It's not free.
Look,
We pay for it in our taxes.
no, but
A lot,
hypothetically, you go down to the doctor, right, and they write it up for free. Right? Now, if they're going to start whinging and whining, saying we haven't got enough money, what we should do, is make sure we get the money.
What they need to
pay
do.
ourselves.
What they need. The NHS would be a good system if they'd stop deliberately letting people abuse it. It's a deliberate thing.
No.
It's got to be a deliberate thing. You know why? Because they get paid for every transaction.
Yes, correct.
The workers get paid
Correct.
while the organisation loses out.
Correct. But worth it. The paracetamol
Corruption.
companies, do charge the NHS overpriced, too much money, and the only way to skim it down, is to put common sense in, and the common sense will be, you pay for your own needs.
No, you just pay for the things that we shouldn't be paying for.
Right. Well, basically, you have your card, right, which is your medicine, okay, right. If you put in, say, like £1,000,
Yeah, but I've already paid for it in my taxes.
no, you put more money, your own wage, your money, right. Forget the taxes. You've done that, right. Now, you earn your money, right. It's up to you to put money into a card that is medicine.
Why should we, as a working, pay even more money above tax just so people who abuse this? Let me tell you something. I don't abuse the NHS.
Look, you don't seem to get the picture.
No, I do get the picture.
Look. Inside,
You want us to pay?
Look,
You want us to pay on the card?
Inside America, they pay tax. It doesn't change, right?
Yeah, but the tax doesn't go towards their health service.
No, it doesn't. It won't ever change. The only way it will change, is if you increase the tax. And then, I'm being nice to everybody, to get, stupid prescriptions, and the essential operation. Yeah. Now, right, if we we would still pay 20% tax, right? But the government closed the door and say, right, here's your card. This is your medicine card. Yeah, right. If you've got a broken leg and the doctor charges you £50,000, you've got to make sure you have £50,000 inside your card.
No way.
Because otherwise, you can bugger off.
No way.
Yeah, but that's what we should have.
No, we shouldn't. I
Yes,
disagree
we should have,
totally.
because that way...
I disagree 100%.
Because that way, we can actually stop all this stupidity.
No, because people who are on a minimum wage... How are people on a minimum wage supposed to pay that?
The paracetamol abuse.
How are people... If I have an emergency where I break my neck, it's going to cost me £200,000 for the treatment, and they're going to turn around and say, oh, you know the money, that's it. That's ridiculous.
Well, I know it's ridiculous, but that's what we should have.
No, we shouldn't.
Yes,
the NHS is a good system. In America, someone has an accident where they have their leg amputated or something, right?
Yes.
Then the insurance won't pay.
Yes.
Then they end up with a £40,000 to £50,000 bill. That's wrong.
No.
That's wrong.
No.
Just because some people abuse the system. That's just wrong.
Yeah, true. But then, the people from America wouldn't go up to the doctor and say, look, I'm feeling unwell, I'd like a paracetamol. Please write it up for me. Blah, blah, blah. They turn around and say bye-bye. Yeah? At that time with, you were clumsy, you fell off the, you fell down the stairs, and you bashed your head. Yeah? You need a couple of stitches. Okay, no problem. Well, a couple of stitches cost you £5.
Yeah, but you're talking about like there's one extreme to the other. You've got somebody who might have an accident and needs £50,000 worth of treatment.
Yeah.
Or about the other thing where people actually, I'll tell you what, where I agree with you, where it should be, people who deliberately poison themselves or do things and don't take the help to change, like alcoholics. Okay, alcoholic is like a disease. Okay, they're addicted to it. They need the program to help them get over it. Now, if you turn around to somebody who's an alcoholic, right, NHS can help them, yeah? I let my taxes go to somebody who's an alcoholic as long as it helps them and it cures them. Lifeline. There's no way at all that somebody who's an alcoholic, no job, on benefits, is going to be able to pay for that. That'll be the end of them. People would probably just top themselves. You know what I mean? There needs to be, I think there should be in it. The NHS is a good system, but like all good systems, it seems to be corrupted.
Yes.
And we need to try and reduce that corruption.
Yeah.
The first thing that should be done, we're specifically talking about paracetamol and things like that being something in the NHS, is turn around and say we don't do that anymore. We'll give you a prescription, or we tell you the location of where to get it. It's as simple as that.
Yep.
And that's that closed off. Next thing, people who are, for example, they have like a gastric band on the NHS, okay?
Yep.
Now, they have one gastric band. Eating unhealthy is a problem, right? But if they've had the training, the education system on the NHS of what to eat, and they know this, but they still choose to go and eat that burger because they're too lazy to do anything else, then they don't deserve NHS money. They don't deserve my taxes if they're going to abuse it, yeah? That's the kind of thing I'm talking about, and that's where I agree with you on. But people that are innocent, who genuinely need help, shouldn't lose out because of those taking the piss, basically. You know?
And you've got all these migrants, and they're the ones
Yeah, that's another topic altogether.
And abusing the system.
They are.
Right? And America is having to give them out for free, Australia is having to give them out for free, and all of those bits and pieces. And they're the migrants running around and with the winds and the whinings and
they take an inch and get a mile.
With the population decrease and the Muslim takes over, right?
Muslims not a race. It's not about like Asian, Arabic people.
There will be back to square one inside our country, where hey, they got to